you're wondering whether you have infection or not, there are certain signs and symptoms that you can get. Some of them are fever, having itches or rashes, having boil around your wongoro machine, feeling pain during urination or wongoring with your partner. These are signs that you might have infection, but some people might not have any signs at all. Infections will affect your fertility, but sometimes you might be able to achieve positive tests even though you have infection. I do not recommend this for you if you're trying to conceive. Make sure that you treat any infection you have before pregnancy occurs. Having infection and getting pregnant with that increases your chance for miscarriages. It also increases your chance for ectopic pregnancy and late pregnancy loss as well. So if you want to ever get pregnant and you know you have infection, treat them properly. Medications that are used for treating infection will depend on what has caused the infection. That is, the microorganism that led to you having the infection. First of all, go to the hospital, see a doctor. They will send you for certain tests to know whether you have infection. Some of the tests are HVS, which is the high vaginal swab. You can also go for STI test because some of the things that cause infection might be wongoro transmitted. You might also need to do blood tests to see whether you have infection circulating in your blood. This will help your healthcare provider or doctor to advise you on what type of medication that you'll be using, because sometimes you might be resistant to certain antibiotics or certain medications that needs to be used, and other forms of medications will be prescribed for you. So medication prescription needs to be done by a doctor, not online, not here. It is true that infection can affect your flow. Flow not coming when it should is not exclusive sign for infection. If your flow ceased, there are certain things that can lead to that. For example, hormonal imbalance, nutritional deficiency, traveling, not getting enough sleep, or even stress. So your nurse or whoever you met telling you that you have infection just because your flow ceased is not right. Getting the right diagnosis will help you to get the right treatment. Since you mentioned that your flow has ceased, look back at what has happened previously and try to understand where the issue is coming from. For example, have you been so stressed lately? Do you have some engagement that you have been doing? Have you been traveling more often lately? Have you changed your diet? Did you start exercising? These things can affect your flow. If you have looked at it and you have tried to make certain changes, and after another month, the flow doesn't come, please see a gynecologist. And I hope this video helps all of you. I'm still your Wongo Nation President, and I'll see you all in my next video. Bye.